So we are going to discuss about the chest X-ray from medicine practical point of view, that is the table viva, the X-ray you are being asked in your practical examination. So suppose if you are provided with an X-ray in examination and you are asked to interpret the X-ray, then how you will start saying about the X-ray or interpreting the X-ray, that is the skiagram, that is the skiagram. Skiagram, skiagram. So usually start saying that, say this is the X-ray you are provided in your exam and you are asked to interpret this X-ray. Then usually start saying that this is a skiagram. What is skiagram? It is a photographic image of the chest X-ray. That is photographic image. So usually start saying that this is the skiagram showing the anteroposterior or posterior-anterior view of the chest. So the first point is the view, whether it is an anteroposterior or posterior-anterior view. Anteroposterior or AP or posterior-anterior, that is the PA view. So the first thing is the view that we will discuss while interpreting the X-ray. So when you say that this is the skiagram showing the anteroposterior view of the chest, then the examiner will ask you that why you are saying this is an anteroposterior view or it is a posterior-anterior view of the chest. So the first thing is the view. So I have put here the two X-ray. One is the anteroposterior and the other is the posterior-anterior view, that is the AP view and the PA view. So you can see here in this first image, this is the AP view of the chest, that is the anteroposterior view. The first thing you can get a hint that here it is written that this is an AP view, chest AP view, that is the anteroposterior view. And here in this second image you can see it is written chest PA view, that is the posterior-anterior view. But how to differentiate while looking at the image that whether it is an anteroposterior or a posterior-anterior view? So we will compare the views. So in the first image you can see that this is an anteroposterior view. In anteroposterior view you can see at the clavicle. So these are the clavicles. You can see in this anteroposterior view the clavicles and the posterior-anterior view the clavicles. What do you notice here? You notice here that in clavicle in the anteroposterior view is more horizontal, whereas in posterior-anterior view it is more oblique, the first thing. And the second thing, the clavicle in the anteroposterior view is more caudally, that means it is more upward, whereas in the clavicle in the posterior-anterior view is slightly downward. So when I remove this marking, can you appreciate that the clavicle here in this anteroposterior view is more upward, while the clavicle here in the posterior-anterior view is slightly downward. This is the one differentiating point of AP view and PA view chest X-ray. The second thing you can notice here, that can you see the border of the scapula here? Can you see or demarcate this border of the scapula here? So this is the border of the left scapula and this is the border of the right scapula here in AP view. And in PA view, can you see the border of the scapula here? Can you see the border of the scapula is here, So what is the difference here? You can see the border of the scapula in AP view is coming in the field of the lung parenchyma. Can you see the scapula is coming here in the field of the lung parenchyma in AP view, while in PA view the scapula is widely separated. It is away from this lung field. So this is one of the important finding in AP view and PO view. So in PA view we try to look at the lung parenchyma. So the scapula should not interfere the lung parenchyma. or the structures of the lung parenchyma, the pathologies of the lung parenchyma. So in PA view, the rays of the projection is projected from the posterior side to the anterior side, and in AP view the rays are projected from the anterior aspect of the patient, while in PA view the rays are projected from the posterior end of the patient. So the clavicles are slightly upward in AP view, the scapula is coming in the lung field or lung parenchyma field in AP view, while in PA view the scapula is widely separated so that we can visualize the lung parenchyma. It is because of positioning of the patient in PA view, that is why the scapulas are widely separated, and the projection of the ray is also coming from the posterior end, so the scapulas are widely separated in PA view. So you have to mention this point that this X-ray is an AP view X-ray or a PA view X-ray. Most of the time in medicine practical examination you are going to get an PA view X-ray. Very rarely you will be provided with an AP view X-ray in such situation, but you may be asked about the differences between the AP view and PA view. One of the difference is the clavicle is slightly more cranially in AP view and slightly more caudally in the PA view. The scapula is coming at the field of the lung parenchyma in AP view, while it is away from the scapula border, is away from the field of the lung parenchyma in the PA view. And one more difference which is not apparent in this comparison is that in AP view there will be an apparent enlargement of the cardiac shadow. Here it is not so, but most of the time in AP view this is the cardiac shadow. Can you see this white structure which I have encircled? This is the cardiac shadow. So there will be apparent enlargement of the cardiac shadow in AP view. So AP view is not a good X-ray to comment about the cardiomegaly. So because there is apparent enlargement of the cardiac shadow in AP view, as the rays is coming from the front, so it will first meet the heart. So there will be enlargement of the or false enlargement of the cardiac shadow in AP view. But in PA view it is not so. What actually is the shadow of the heart will be projected here. So there are mainly three differences between the AP view and the PA view X-ray. First, about the clavicle, which is more cranially, the scapula which is coming in the lung parenchyma field, and there is an apparent cardiomegaly or false cardiomegaly in AP view. So you have to start saying that this is a skiagram showing the posterior anterior view of the chest. Then the examiner will ask you why you are saying it is posterior anterior view. Then you have to mention about these 3 points, that the clavicle is more caudally, the scapula is away from the lung parenchyma field, and there is no apparent cardiomegaly. Then you come at the rotation of the X-ray. You say that this is a skiagram showing the posterior anterior view of the chest, and the X-ray is a well-centered X-ray. You will say the X-ray is a well-centered X-ray. How you will know that the X-ray is a well-centered X-ray? What are the things you are going to look to say that the X-ray is a well-centered X-ray? So here, while I make a marking, can you see this spinous process, this rounded spinous process when I remove this marking? So these are the spinous processes of the vertebra. Can you appreciate that these are the spinous processes of the vertebra which can be barely seen? So the distance between the medial end of the clavicle, and this is your clavicle, and this is the medial end of your clavicle, this is the medial end of your right clavicle, and this is the medial end of your left clavicle, and this is your spinous process. So the distance between the medial end of the clavicle to the spinous process on the right side, and the distance between the medial end of the clavicle to the spinous process on the left side. should be equal to say that the X-ray is an well-centered X-ray, which means the technician or the radiology technician has done this X-ray so beautifully that it is an well-centered X-ray. The beams are projecting on the chest centrally, exactly the beams are projecting centrally. So to say that the X-ray is a well-centered X-ray, the distance between the medial end of the clavicle to the spinous process on the both side should be equal. In this it is almost equal. The distance between the right side and left side from the medial end of the clavicle to the spinous process is almost equal. So you see in this image, so can you appreciate that this is an spinous process? This is the medial end of the right clavicle and this is the medial end of the left clavicle. Now see, the distance on the right side is less, the distance on the right side is less compared to the left side. So this X-ray is not an well-centered X-ray. This is a rotated film. This is a rotated film. This is a rotated film. So you have to say that this is a skiagram. This is a skiagram showing the posterior anterior view of the chest. It is a rotated film. It is a rotated film. Now the examiner will ask you why you are saying it is a rotated film. So you have to answer the distance between the medial end of the clavicle to the spinous process on the right side is less compared on the left side. So it is a rotated film. And this X-ray almost it is equal. So you can say that this is a skiagram showing the posterior anterior view of the chest. Why posterior anterior view? Can you see the scapula is away from the lung parenchyma? Can you see here the scapula is medial border of the scapula is not coming in the field of lung parenchyma, not coming more in the field of lung parenchyma. So it is a PA view and it is a well-centered X-ray. So you say about the view, you say about the rotation, and then you have to say about the exposure. So how you will say about the exposure? That this is a skiagram showing the posterior anterior view of the chest, and this X-ray is a slightly rotated film. Can you see the distance? It is slightly rotated film and it is a well exposed film. So how you will come to know about the exposure in the X-ray? So through the shadow of the heart. So this is the shadow of the heart. So through the shadow of the heart, the vertebra, the lower thoracic vertebra should barely be visible. These are the vertebrae. Can you see? These are the vertebrae. So through the shadow of the heart, when you look through the shadow of the heart, the lower thoracic vertebra should just be visible, or it should be barely be visible. Can you see that these vertebrae are barely visible, just visible? These vertebrae are just visible. So if through the shadow of the heart, the lower thoracic vertebra is just barely visible, just barely visible, means is visible very little, then the exposure is normal, then it is adequate exposure. The exposure is adequate. So this is an well exposed film, or the exposure is an adequate exposure if the lower thoracic vertebra through the shadow of the heart is barely visible. So look at this film. Can you see any vertebra through the shadow of the heart? Very difficult to see the vertebra through this shadow of the heart. Can you appreciate that you cannot see any vertebra through the shadow? This is the shadow of the heart. So you cannot see any vertebra here through the shadow of the heart. Cannot see. So this is an underexposed film. If you cannot see any vertebra through the shadow of the heart, this is an underexposed film. And look at this image. In this image, through the shadow of the heart, the vertebra is very clearly visible. It is not barely visible, but it is very clearly visible. Through the shadow of the heart. The vertebrae are very clearly visible. Then this is an overexposed film. This is an overexposed film. If it is very clearly visible, it is an overexposed film. If it is not visible at all, it is an underexposed film. Then what is normal? Normal is the vertebra through the shadow of the heart should just barely be visible. It should not be visible completely, neither it should be invisible, but it should be barely be visible. It should barely be visible through the shadow of the heart. That is the normal exposure or the adequate exposure. Then you have to look whether this film is an inspiratory film or an expiratory film. So till now, how you will interpret the X-ray is that this is the skiagram showing the posterior anterior view. This X-ray is slightly, or this skiagram is slightly a rotated film, and there is well exposed or adequately, this skiagram is adequately exposed. Then you comment that this is an inspiratory film or an expiratory film. How to know whether it is an inspiratory film or an expiratory film? For that you have to know about the ribs. So can you see the ribs here? Whether can you appreciate that there is one rib here? These are the ribs. And can you appreciate that there are ribs which is coming in this direction? There are ribs which are coming in this direction. Can you appreciate that these are the ribs which is coming in this direction? So, and there are the ribs in this direction. So there are anterior ribs and the posterior rib. So how to know which rib are anterior and which rib are posterior? Which ribs are anterior and which ribs are posterior? In this image I can show you the anterior rib and the posterior rib. So this is one rib which is coming in this direction. This is another rib which is going in this direction. This is another rib. This is one rib, this is one rib. And can you appreciate that this rib is turning and coming anteriorly, turning and coming anteriorly? So, and these are the rib which is almost be seen coming out from the thoracic vertebra, coming out from the thoracic vertebra. So what do you think, which rib is an anterior rib and which rib is an posterior rib? So as we know, the rib cage, the rib which originate from the thoracic vertebra, the rib which is originating from the thoracic vertebra, and if the rib is coming anteriorly, originating from the thoracic vertebra, and rib is coming anteriorly and terminating here. Why it is terminating here in this X-ray? It is not continuing because from here the ribs are attached to the sternum via the cartilage, and cartilage are not visible in X-ray. Only the bones are visible in X-ray. That is why you can see the rib which is coming in this direction is the posterior rib, and when the same rib will turn and will come anteriorly, then this will become the anterior rib. This will become the anterior rib and it will terminate here. So this is the anterior rib and this is the posterior rib. So remember, the posterior rib are one that is originating from the thoracic vertebra, so it is close to the thoracic vertebra, but the anterior rib is away from this thoracic vertebra, away from the center or away from the thoracic vertebra are the anterior rib, and which are close to the vertebra are the posterior rib. So these are the posterior rib which is close to the vertebra, these are the posterior rib which is close to the vertebra, and these are the anterior rib which are terminating here, because from this to the center of the sternum or to the side of the sternum is the cartilage which is not visible. So this is the way you differentiate between the anterior rib and the posterior rib. The posterior rib are close to the center and the anterior rib are away from the center, Then how to know whether it is an inspiratory film or an expiratory film is that while the X-ray is being taken during inspiration, then you can see almost 6 or more anterior rib. So this is one anterior rib, second, the third, the fourth, the fifth and the sixth anterior rib. So it is more than 6 anterior rib, and the posterior rib should be around 8 to 9. If you see more than 8 to 9 posterior rib, this is the 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, almost 10, almost 10. So if the anterior rib can be seen more than 6 and the posterior rib can be 6 more than 8 to 9, then it is an inspiratory film, which means the X-ray or the photographic or the skyagram is being taken during the inspiration or when the patient is holding his breath during inspiration. So while taking the chest X-ray, the patient is asked to take a deep breath and then to hold the breath. So when the patient will hold the breath, at that very moment the X-ray is taken so that we can see the lung parenchyma very clearly. So normally the X-rays will be an inspiratory film. But how you will know that the X-ray is an inspiratory film? If you see the anterior rib, it should be more than 6 anterior ribs should be visible, and the posterior rib more than 8 to 9 posterior rib should be visible to say that the X-ray is an inspiratory film. If it is less, then it is an expiratory film, or the patient have a poor inspiratory effort. The patient have a poor inspiratory effort. So till now, how you will say about this X-ray or interpret about this X-ray, that this is a skyagram showing the posterior-anterior view of the chest. So in exam most of the time you are getting posterior-anterior view. So this is the skyagram showing the posterior-anterior view of the chest. This X-ray is a well-centered X-ray, almost equal well-centered X-ray. This X-ray is slightly underexposed. You cannot see any vertebra. It is a slightly underexposed X-ray, and it is an inspiratory film. It is an inspiratory film. So you are mentioning all the point, the view, the rotation, the exposure, and the inspiratory film. Now after mentioning all this point, now you have to say the normal structure or the structure visualized here. The structure visualized here are the rib cage, the clavicles, the rib cage, the sternum, the cardiac shadow, the diaphragm, and almost little bit of the upper part of the abdomen, Then you have to comment about the structure visualized. So the structure visualized here are the rib cage, the cardiac shadow, the lung parenchyma, the diaphragm, the shadow of the diaphragm, and little bit of the upper part of the abdomen, So after interpreting the X-ray or starting to interpret the X-ray, that this is the skyagram showing the posterior-anterior view of the chest. It is a well-centered X-ray and well-exposed X-ray, and it is an inspiratory film. Now you will say that the structure seen here are the lung parenchyma, the rib cage, the cardiac shadow, the shadow of the diaphragm, and little bit of the upper part of the abdomen, So what are the normal thing we look for in the X-ray? So can you see angle here which is coming from the costal margin and to the diaphragm? Can you appreciate that there is an angle created here from the costal margin and the diaphragm? This is known as the costophrenic angle. So this is known as the costophrenic angle. This is known as the costophrenic angle. So both side you can appreciate that there is a costophrenic angle. The angle from the rib and the diaphragm, this is the costophrenic angle, and normally air is present in costophrenic angle, and air in X-ray will be black. So these are the black structure you can see which is forming an angle. This is the costophrenic angle. And can you appreciate the angle between the diaphragm here and the border of the heart? The angle between the diaphragm and the border of the heart. So this angle is a cardiophrenic angle. And this angle is a costophrenic angle. One more angle you can be asked here. Is the subcarinal angle. So where is the subcarinal angle? Can you see here in the trachea? Normally the trachea contain air, so it will be black. So can you see here the trachea or the margins of the trachea? So this is the trachea which is coming down and dividing here, Can you appreciate this? Can you appreciate this? The blackiness which is coming down here and dividing. When I remove this marking, can you appreciate that this blackiness is coming here and is dividing, coming here and is dividing, coming here and is dividing. So can you appreciate? So this angle is the subcarinal angle. This angle is the subcarinal angle. So it is important. We have discussed three angles: the costophrenic angle, the cardiophrenic angle, the costophrenic angle, and the subcarinal angle, So if you are asked, show me where is the subcarinal angle, the trachea which is coming and divided into right and left bronchus, main bronchus, and the angle formed between the division is the subcarinal angle. So the structure here you can appreciate is the costophrenic angle, the cardiophrenic angle, and the subcarinal angle. In this image it is little bit difficult to see the subcarinal angle which is coming here and is dividing is the subcarinal angle. So sometimes you may be asked, what are the hidden areas of the lung in chest X-ray? The hidden areas of the lung are the apex of the lung, the hidden area. If there is some pathology in the apex of the lung, most of the time you may miss the pathology. That is why it is known as the hidden area of the lung. If there is some pathology behind this cardiac shadow also, you may miss that pathology. That is the hidden area of the lung. Behind the rib you can mix the pathology, and the hilar region, this is the hilar region also is a hidden area of the lung. The apex is the hidden area of the lung, and behind the ribs, if there is some pathology, that can also be hidden, and behind this cardiac shadow are the hidden areas of the lung, So this is all you need to know about the normal of the lung. Then you have to comment about the pathology. What are the pathology you are seeing in this skiagram or X-ray? But before that, you have to start saying that this is a skiagram showing the posterior anterior view. It is well exposed, it is not rotated film, and it is an inspiratory film. The normal structure seen are the lung parenchyma, the rib cage, the cardiac shadow, the shadow of the diaphragm. So you comment up to here, then you have to comment about the pathologies of the lung. Then you have to comment that what pathology you are seeing in this X-ray. So most of the time, if you are not understanding the pathology of the lung, but your approach is normal, or if your approach is good, that you are commenting about the view, the exposure, the position, then you are going to pass. If you are an undergraduate student, if you are going to pass. So the approach is important. So in next video we will discuss about the pathologies of the X-ray, the chest X-ray, what the pathologies you are going to get in the X-ray, and how to comment about that pathology, how to comment about pleural effusion. You have to not directly say that this is an X-ray showing a pleural effusion, but there is a way to comment about pleural effusion, the consolidation, the pneumothorax, and how to identify those X-rays. So before exam you not need to see any images, just you look this video or watch this video and you go in exam, you will be able to identify almost every X-ray. We will discuss that. So in next video we will discuss about the pathologies of the X-ray, and for other clinical videos of the other system, the respiratory system, the examination, nervous system, cardiovascular system, every system of medicine, there is videos for clinical examination on every system, the clinical examination, and viva voice discussion for every system. You can go and watch the clinical examination video for every system and viva voice discussion in all system course that is created for you. You can download this app from the Play Store. You can download this app, Dr. MedRay, from the Play Store. There you will find all the videos about the clinical examination, how to examine a patient from every system, and how to approach a patient for your exam and your viva voice and table viva question. Everything is available in this app in Play Store. Go and download, or you can download from the link in the description. So in next video we will discuss about the pathologies of the chest X-ray.